Okay. Good afternoon, everyone. Thank you for joining us for our first fertility lunch talk. This is part of a series of 4 short sessions designed to share helpful insights on fertility, health, and well-being. Today's topic is diminished ovarian reserve, an important aspect of fertility that many individuals and couples may face. Before we begin, if you have any questions during the session, please feel free to drop them in the chat box and we will address them during the Q&A segment later. It is my pleasure to introduce our speaker, Dr. Sheila Loh, Clinical Director of Raffles Fertility Centre. Dr. Loh brings with her over 30 years of experience in obstetric and gynecology and infertility care. For today's webinar, Dr. Loh will be sharing about 15 minutes, followed by a 15-minute Q&A session. Let's warmly welcome Dr. Sheila Loh.
Thank you for the kind introduction, Glenda. It's my pleasure today to spend the lunch hour with you. Thank you very much for sacrificing part of your lunch hour to attend this short educational talk. So this information today is for reflecting current knowledge and clinical practices in fertility, but for each individual couple or person, your situation may be unique to you and you may want to consult your own fertility doctor or gynecologist regarding decisions and your own results. So without much further ado, we go into what is this disorder. So for ovarian reserve, just a background story, females are born with about 2 million eggs, and this is all we have to last us for our lifetime. At puberty, a young girl is estimated to have only 500,000 eggs at the start of her first menses. Many of these eggs are lost even before the first menses, and this is because egg cells will die over time. And the rate at which we lost these egg cells increases much more once we reach our mid-30s. So once a young lady starts to have regular menstrual cycles, several hundred to 1,000 eggs are lost every month, with only 1 or 2 egg cells becoming mature and released at ovulation. A woman will not make any new egg cells in her lifetime and would therefore reach menopause, which is when we run out of all functional eggs and our periods stop. So with that background, let's look into diminished ovarian reserve. Diminished ovarian reserve is called a silent disease, and this is because a woman that has diminished ovarian reserve has fewer egg cells remaining in her ovaries that is typical for her age. While egg supply naturally decline over time, in diminished ovarian reserve, this process is happening faster or earlier than expected. In the average woman, the rapid decline in ovarian reserve usually begins in the early 30s. As you can see in the first slide, we said that it already starts diminishing from birth to puberty and from puberty to 30, but the rapid decline starts around the early 30s. This becomes more pronounced over the next 5 to 10 years when we hit 35 or 40 years old. And that is the reason why women in their 40s have a reduced egg reserve, and fertility is significantly reduced when we reach the perimenopause period. Most women with diminished ovarian reserve do not have any physical symptoms. And that's why, as I said before, it is a silent disease or disorder. In many cases, women find out that they have diminished ovarian reserve either through ovarian reserve testing or when they experience fertility issues. In some cases, some women will experience having shorter menstrual cycles or fewer days of menstrual flow. When ovarian reserve is very, very low, the symptoms of low estrogen levels then appear. These can be infrequent menstrual cycles or a cessation of menstrual cycles, or perimenopause symptoms like hot flushes, dry vagina, mood changes, lethargy, and even painful intercourse. Symptoms, however, often overlap non-specific signs that may be attributed to stress, work, relationship matters, mood swings, or even sleep issues, because this is the peak age group at which you are building your career, you're looking after your parents, and there's quite a lot of work stress and time issues, especially in busy Singapore. Causes. So in many cases, no cause is found. And researchers have identified that ovarian reserves are influenced by both genetic and environmental conditions. Other factors that may contribute to diminished ovarian reserve become more likely, such as medical treatments, for example, cancer treatments, especially cancer treatment that involves radiotherapy, chemotherapy, past ovarian surgery, for instance, to remove a cyst or because of some abscess. Lifestyle factors like heavy smoking and alcohol will cause a woman to reach her menopause 2 years earlier than non-smokers. Obesity, anorexia, and poor nutrition can affect the rate at which we lose our eggs. Other diseases include endometriosis, autoimmune conditions such as Hashimoto's thyroiditis, hypothyroidism, systemic lupus erythematosus, type 1 diabetes, mellitus, and rheumatoid arthritis, because they all have some autoimmune inflammation that might impact on the loss rate of your eggs. So we lose our eggs faster if you have an autoimmune disease. How is ovarian reserve diagnosed? Diagnosis, as per usual, when you see your gynecologist or doctor, starts with a medical examination to screen for these diseases, physical examination, and often pelvic examination. However, diminished ovarian reserve is diagnosed by a combination of pelvic ultrasound scan and a blood test measuring the anti-Mullerian hormone levels. And the definitive diagnosis is by these two tests. Anti-Mullerian hormone test is a blood test that checks for this hormone, and lower levels typically indicate a smaller remaining egg reserve and predicts earlier menopause. Antral follicle count is a number of immature eggs that a woman produces each month and loses each month. And an ultrasound scan to count this may give an idea as to how fast you're losing your eggs. So what are the levels to watch for? And this is where there is a little bit of less consistency among different researchers. The anti-Mullerian hormone is typically a mean or average is in the 28.6 range in the early 20s, drops to about 20 in the early 30s, but drops to only about 6 in the early 40s. As you can see, by age 45, it's about 1. For antral follicle count, which is the immature egg count in your ultrasound scan, is typically still 14 to 16 little immature eggs per month. In the early 20s, drops to about half that. By the time you're late 30s, 8 to 10, and by the time you're in your 40s, 5 to 7, and very few by the time you're in the mid 45s. So in diminished ovarian reserve, the anti-Mullerian hormone is below the 25th centile for age. So these are median or mean, which is 50th centile. But in diminished ovarian reserve, is 125th centile for age, which is lower and than expected for that age. There is no treatment to increase ovarian reserve back to normal. Please remember this. So if you have been having fertility issues, meeting with a fertility specialist or gynecologist can help you determine a treatment plan that best meets your needs and goals with whatever reserves you have and to maximize the egg quality at that time. So is pregnancy still possible? And that's a frequent question we are asked. Diminished ovarian reserve is an indicator of reduced reproductive potential. It does not mean pregnancy is not possible. It is still possible to conceive naturally, especially if you are young and below 30 years of age, as the egg quality is still very good. Older women or other women have been successful with the help of IVF, and the primary impact is that it often takes longer to conceive, and some couples will require specialized fertility treatments because there are multiple infertility factors, but by the time you're a little bit older. Treatment options. So for young women who are not married yet, they can consider egg freezing between age 21 to 37 plus years of age. That's the upper limit of age allowed in Singapore by our Ministry of Health. Others who have already gotten married and are starting a family can consider superovulation, intrauterine insemination if they have no other infertility factor other than diminished ovarian reserve, because this will increase your chances over natural conception without the use of IVF. The third option would be IVF or in vitro fertilization for couples who already have infertility problems or a little bit older where egg quality comes in. IVF with donor eggs is a last resort for older couples or those with near ovarian failure. And as I said before, we cannot regenerate our eggs. We can just maximize damage or reduce damage to our eggs by living healthily. The major impact of diminished ovarian reserve include not only reduced fertility potential, it also includes mental health and stress for regarding fertility issues, menstrual cycles, and also metabolic and cardiovascular health and bone health as our estrogen levels diminish. In conclusion, diminished ovarian reserve have no or few signs and symptoms, and that's why we call it the silent disorder. The main causes are genetic causes, ovarian surgery, and lifestyle factors. It can be diagnosed by a simple blood test for anti-Mullerian hormone and an ultrasound scan for antral follicle count or AFC. Treatments available range from egg freezing to IUI programs to IVF programs to donor eggs for those who have run out eggs. We can optimize our non-fertility related measures with whatever eggs we have left behind by living a healthy lifestyle with good sleep hygiene, balanced diet, exercise, control our BMI and stress levels, and avoid toxins such as heavy smoking and alcohol. A few facts about egg freezing in Singapore. This was started since June 2023 by MOH guidelines or regulations. There is age restriction, as I said previously, 21 years to 37 plus years of age, compulsory medical counseling and cooling period. If you're at 38 years of age, then the Ministry of Health does allow appeal and your doctor can write in to appeal for you to see if you can complete your cycle before you are much older. Downtime for egg freezing is about 2 weeks, plus or minus 5 days for another recovery as the ovary shrinks back to its normal size and your hormones drop back to normal. Please note that long flights during this period should be avoided because the high estrogen can cause deep vein thrombosis. The aim is to freeze enough mature eggs to give at least one live birth. And the number of eggs you need to collect depend on your age, your egg quality, and a discussion with your fertility expert. At Raffles Fertility Centre, we offer personalized treatment to maximize successful outcomes. So that's why each patient will be counseled by their individual doctors as to their individual situations and their desires. There is minimal wait time to start treatment. So as long as we fulfill all the Ministry of Health guidelines and criteria, which is medical counseling, informed consent, and infectious disease testing before starting the treatment. So with that, I'd like to conclude my short lunchtime talk and thank you very much for paying attention during your important lunchtime. To you, Glenda, please take over.
Thank you, Dr. Law, for very insightful and informative sharing. We will now open the floor for Q&A. So please feel free to type your questions into the chat box. We would love to hear from you. If there will be some questions that we are unable to answer, we will going to reach out to you via email. Okay, as we go through the questions, you'll see a slide introducing our fertility specialist along with our contact details in case you'd like to reach out for or find out more about today's session. All right, so we see any questions that we're gonna have. Dr. Law, we do have a question here. Does Ozempic or any GLP-1 injections affects ovarian reserves?
Okay, that is a very good question. So Ozempic and similar medications do not per se affect egg reserves or ovarian reserves. But in fact, if the person is obese or has diabetes and is using these GLP-1 medications, it may improve their metabolic function and improve their egg quality. So numbers and reserve are not affected, but egg quality may be improved in such people. Does
Okay,
that
thank you,
answer the question for you? Yeah.
Yeah. Thanks, Dr. Law. So we have another question. Does having menopause at older age means the reserve was high?
Yes, generally, high later age at menopause corresponds to bigger egg reserve because, as I said, the egg reserves do run out generally at a certain rate, and by 50 or 55 years old, a person would reach menopause. The average age of menopause is actually about 50, 51 years old in most countries, regardless of your ethnic group, but the range is quite wide, is between 48 to about 56 years old. So a person with very high egg reserves will run out a little bit later. This does not mean the person is fertile all the way till 58 or 60 years old, because the egg quality would have diminished and there's a very high rate of abnormal eggs or genetically abnormal eggs. That's why they cannot conceive despite still having eggs.
Yay! Thanks, Dr. Law. We do have here, is low ovarian reserve hereditary?
Okay, that is a very good question. Low or diminished egg reserves is determined genetically and is what we are born with. There is a good correlation with abnormality in some chromosomes, which is our genes, and this include abnormality in chromosome X, which is the gender determining chromosome. Uh, Also, it has been known that low egg reserves may run in families. So it's not only genetic, but it's familial. So the two are different. Familial means there seems to be a family history of an aunt, a mother, a grandmother who had low egg reserves, and genetic means it was tested and determined that something was abnormal regarding their X chromosome, such as Fragile X syndrome, Turner syndrome, other gene mutations.
Okay, Dr. Law. So we have another question. When should I get tested and how long is the lead time?
If you suspect you might have low rate reserves, for example, you're already beginning to have menstrual irregularity, change in your menstrual flow and pattern, you may want to get a test done with either your GP or your gynecologist. Anti-Mullerian hormone is a simple blood test that can be done anytime in your menstrual cycle and does not depend on timing with your period. The results are out very fast, and within a few days you can get your result and can then know what is your egg reserve like. There are some temporary factors that can skew those results. So if you're on long-term contraception, it might make the result a little bit lower, such as long-term birth control pills or long-term contraception, such as with the Mirena IUD, because this suppress the follicles from producing anti-Mullerian hormone.
All right. There's another question. If I have a low ovarian reserve and would like to do egg freezing, does it mean I need to do several cycles of egg freezing?
This really depends on your result of your egg freezing procedure, how many eggs can grow and respond to the medication, and what you desire in terms of family planning. So in general, if you were between 30 to 34 years old and you only collected 6 eggs, there would be statistically a 40% chance of one live birth. But if you intended to have 2 children, there's only a 10% chance of 2 live births. So you would have to discuss this with your doctor. Most patients only need to do 1 to 2 times. But if you wanted a bigger family, or if you were unable to collect enough eggs in your initial attempts, you might need up to 3 times, but it is really very rare to need more than 3 procedures. So most people would expect to do 1 to 2 procedures.
Okay. We have another one is should everyone that is planned to get pregnant went through AMH as a screening check?
In general, AMH cannot predict fertility. It can only predict egg reserve. There is some correlation with fertility because if it's very low, it might indicate that egg numbers are diminishing very fast. And when it's very, very low, it might indicate that you're running out of eggs. So if you're much younger, it's best to start as early as possible for your family. The egg reserve test or AMH can give you an idea of your timeline and what kind of plans you want to make in terms of your reproductive potential. So it's very, very individualized in that sense.
Okay. Thanks, Dr. Lois. Another question is there any supplements to improve the ovarian reserve?
Ovarian reserve cannot be changed. As I said, yes, what you're born with, it diminishes over time. But there are supplements that can maximize or reduce the damage to your body by environmental toxins, and they're thought to be things like coenzyme Q, which will prevent oxidative damage or free radical damage. Uh, Ozempic, like I said, improves the metabolic quality in the body if you are obese or you have diabetes. And several people have tried also adding vitamins, but there's very little proof that they can actually improve the egg quality and none that they can improve egg quantity. So diminished ovarian reserve is a diagnosis of low egg quantity. It does not take into account the quality of the eggs.
Okay. Is low estrogen a possible threat for diminishing ovarian reserve?
Can you repeat that question, Glenda? I missed the first part.
Is low estrogen a possible threat for diminishing ovarian reserve?
There are many causes of low estrogen, and low estrogen levels are one of the associations with diminished ovarian reserve. So if your estrogen level is low, your doctor will need to correlate the estrogen level with that time in the cycle because estrogen levels vary with the menstrual cycle.
Okay. If having a irregular menses, does it mean I have a low ovarian reserve?
Having irregular menstrual cycles doesn't always mean you have a low ovarian reserve. Menstrual cycles are dependent a lot on things like lifestyle, stress, and other diseases. If, however, you have noticed that you had very regular menses before and they're changing, then it would be good to look for a cause. And one of the causes of low menstrual irregularity, a change from a regular menstrual cycle previously, is low egg reserve. So your doctor would want to exclude this for you. There are many causes of irregular cycles, as I said before, including thyroid disorder, hyperprolactinemia, change in weight, or change in terms of weight gain or weight loss. Medications can affect it. So your doctor would want to exclude all this and include also excluding diminished ovarian reserve as one of the causes.
Okay, so there's a question here. Is egg freezing permissible for unmarried females?
Egg freezing is permissible in Singapore whether you're married or unmarried. The only criteria is you have to go through the medical counseling, the consent form decision, and the age criteria, which is restricted to above 21 years and below 38 years, so up to 37 plus years.
All right. There is a question here. What about ovarian rejuvenation and platelet-rich plasma or PRP?
So ovarian regeneration and platelet-rich plasma treatment is for those who have reached menopause or run out of eggs. It is not a part of this topic and is under research. There is some proof that it might help, but there is no outright proof that it will definitely regenerate back your eggs. So it's among the numerous methods that women who have reached menopause or near menopause try to rejuvenate eggs in order to prolong their fertility. So that's why diminished ovarian reserve is important because you want to act before you reach that final stage.
There's another question. If I'm not planning to have a kid, can I just ignore the DOR?
If you're already planning to have to start your family or planning to have children,
No,
you
Dr. Lo, it's not planning. Not planning to have a family or not planning to have a kid.
so if you're not planning to have children and you're not intending ever to have children, then diminished ovarian reserve is not so important for you. But having a test done may indicate to you whether you are going to have early menopause or not. And if you have early menopause, you will want to take steps to maintain your health in terms of, like I said, bone health, heart health, uh, mental health. So diminished ovarian reserve's main impact is on fertility and reproductive options, but it can impact other aspects of your health.
Okay, do we have any a few more questions? We're going to end the topic this webinar soon in 3 minutes time. Yeah, so if you have any other questions, you can put it in the chat box. Then we will try to give you an answer via email. All right. So there's one here. For there's the PRP available in Singapore.
I think you have to go through HSA to bring in PRP. HSA is Health Sciences Authority, so currently it's not mainstream treatment.
All right. So if there's no other questions, we can have this webinar finished. So thank you again, Dr. Loh, for your time and for sharing your expertise with us today. And thank you, everyone, for joining us over your lunch break. We really appreciate you being here. We hope you find this session on diminished ovarian reserve helpful and reassuring. If you have any further questions or would like to speak to our specialist, please feel free to use the contact details shown on this slide, and we look forward to seeing you at the next Fertility Lunch Talk. Take care and have a lovely day ahead.
Thank you and have a lovely day.